Good day, everyone, wherever in the world you may be. My name is Debraj Shom, and it's a matter of great privilege and honor to be speaking on the Advances in Surgery channel for the young group of the American College of Surgeons. I'm a very proud fellow of the American College of Surgeons, and these are some of my training and accreditation details at this moment in time. I am practicing currently in India, and I trained in multiple places in the United States, and I'll sort of take you through my journey as I've been requested to do in this presentation. I will be talking on the business side of practice in mid-career and my learnings from the same, and I hope that this will be interesting for all of you, and you will then be able to possibly utilize some of the learnings and also take it to your own practice as you move forwards in your career. So all in all, I started my career from an ophthalmology residency. I completed a residency in ophthalmology in India, and then I completed a fellowship in oculofacial plastic surgery from one of the topmost institutes in India. After that, I trained in the US in multiple training programs, first in Utah in facial plastic surgery, then in Houston, Texas in head and neck surgery, and then finally in the UK in craniomaxillofacial surgery. So all these multiple specialty fellowships in the face were done by me in order to go ahead and get a significant depth of knowledge in the face. As we understand it, multiple specialties work on the face, and multiple specialties have their own advantages. So maxillofacial surgeons are probably dealing more with hard tissue problems, whereas the facial plastic surgeons are dealing with more soft tissue problems. So going to these multiple through these multiple fellowships allowed me to possibly become better at my craft. After I completed my fellowships, I also enrolled for a full-time MBA at the Vanderbilt University at Nashville, Tennessee, and then completed the same in the final semester of the same at the National University of Singapore in Singapore itself. I've currently enrolled for a PhD at the Maastricht University and will be completing that hopefully in the next couple of years. I am a serial entrepreneur, which means that once I had acquired these fellowships and got the depth of knowledge in my training, I went in for an MBA and started thinking of ways that I could cause growth and ways in which I could bring newer solutions to people all over the world. My first venture was a venture called MediAngels. It was an e-hospital, which was private equity funded in India. It was probably ahead of its time in 2009 and 10. And the objective was to sort of use the internet in order to bring various facets of healthcare together on the online platform. So we called it the world's first online hospital. And as often happens with ideas which are ahead of its time, we did raise a Series A, but ultimately this business or this venture needed to be sold at a discount, and we ultimately had to exit it. Currently, I run a chain of clinics. We run a chain of clinics called the Aesthetic Clinics, and the Aesthetic Clinics are located in 10 plus cities in India. So we have multiple centers all over India, and I'm an inventor. We've invented a hair loss solution called the QR678, which has a US patent, which has an Indian patent, and has FDA approval in multiple countries. I'm also an author with a couple of bestseller books, which are currently listed on Amazon India and Amazon globally. So that's what I do in terms of my current status. We also believe in training, and we have a accredited fellowship program which trains young surgeons and helps them become better at what we do. And this is my life's journey up until now. So in general, you know, for a surgeon who spent probably 12 years to learn surgery and became better and attempted to become better at whatever we do, I have certain learning. So I initially concentrated in trying to get depth of knowledge in my field, or my field, which is facial plastic surgery. But currently, as I look at my entrepreneurial role, facial plastic surgery is probably taking up about 50% of my time. The rest of the time is spent in all of these things that you're seeing on the slide. Collaboration is important. It is very important, especially as doctors, to realize that you will have to work in teams. You will have to build teams. Ultimately, if your teams don't do what they are supposed to do, if your reception staff is not doing its job, or your marketing team is not doing its job, ultimately it's not going to work out for you even as a surgeon. So I do see a lot of doctors in their early and their mid careers sort of talk disparagingly about their admin duties, but administration is important. Administration is actually the foundation on which a surgical practice really rests. And it's important that every step of the customer's journey is handheld by you as an entrepreneur. Now, thinking about growth is important. Some of us will have an institutional practice, and in that case, thinking about how to get patients past the door is not really our job. But ultimately, unless we rely on ourselves and figure out a way by which we can keep growing in terms of numbers of patients as well as the amount of revenue, it does become very difficult to do anything else. For instance, we run a philanthropic organization as well. That's another of the many hats that we wear. And we do perform approximately 10% of all our surgeries completely pro bono. But that needs to be funded by the amount of money which is coming in through profitable businesses. Ultimately, even when you're on a plane, you have to first tie your own oxygen mask before you can go ahead and help others. So from that perspective, setting up teams, collaborating with other specialties, growing, providing thought leadership for your team is very, very important. There is no way that you'll be able to cause growth and take your career to the next level unless and until you think of leadership in all these fronts. There are very few people who are exceptional surgeons, but are not good at presentations, but are not good at collaboration, are not good at marketing, do not understand anything about how to communicate with people and who can continue to move forward. So really, essentially, I mean, unfortunately, no one tells us this in med school, but 80% of your growth is going to be caused by other things. It's going to be caused by the remaining things which actually propel growth. Your surgical expertise, you'll be able to demonstrate, but even to demonstrate that, you'll need the ancillary skills, which unfortunately may not have been taught to many of us in med school. So as a doctor, it's important to keep learning. So all in all, as someone who started their career as a surgeon, trained for 12 years to become a better surgeon in the face, and now perform surgery only 50% of the times, but we have our own products which are going globally to all parts of the world. We have our own chain of clinics, which now has multiple members in the team, multiple consultants who take care of different parts of the face and the body. It's a plastic and cosmetic surgery chain. It's important to understand that each of our visions may be different. What I do may not be interesting for you and vice versa, but in general, even if you try and transpose my message, even if you work in an institutional practice, it might be very useful for you if you think of all of these things. So my take-home messages for today's talk is actually only 3. The first thing is, as doctors, we tend to believe that depth of knowledge is important. Medicine is becoming all about depth of knowledge. You do your medicine residency, then you do your endocrinology, and ultimately you're working only in diabetes. But what you need to understand is the pancreas is also part of the whole human body. And treating patients in silo using our depth of knowledge does the patient no benefits really. So knowing your knowledge, having your knowledge and depth is important, but you also need to know a little bit more about medicine and have breadth of knowledge about the other systems of the body. The same is true as an entrepreneur. You might have depth of knowledge in surgery, but you're not going to make much headway until and unless you have breadth of knowledge, which means that you have breadth of knowledge on the way that marketing runs, medical legal issues need to be handled, how you need to build teams, how you need to have collaboration, how you need to generate revenue, how you need to be profitable, and ultimately how you need to make sure that your businesses keep moving forwards. So from that perspective, having the breadth of knowledge as an entrepreneur, knowing a little about all of these things prevents other people from taking you for a ride. And then your team respects you more because you know all of these things and you can then give them ideas which they might never have thought of. So that's my first take-home message. The second take-home message, unfortunately, especially in Asian cultures like India, and also in some places in other parts of the world, I have seen doctors carry a chip on their shoulders, especially surgeons. So we come out of med school, we go through these multiple fellowships, rigorous fellowships, and we come out with a chip on our shoulder which says, I am Dr. So-and-so, and I mean, people should give me respect. Well, everyone deserves respect. And the moment we think that we know it all, we are actually stunting our own growth. So from that perspective, it's absolutely critical to keep learning. And you will never be able to keep learning unless and until you keep quiet, you zip it up once in a while, and use your ears to learn and listen. And it's important to keep learning because the world today is changing so quickly. My career today, 5 years later, looks so different from the way it was the five years from now. And it'll probably be very different in the future as well. Careers are changing really quickly. We are in a phase of the world where there's going to be more explosive growth happening in the next decade than probably happened in the in the last few centuries. So from that perspective, realizing that what we know is only the tip of the iceberg and to keep learning is to move the needle forwards for us and for our careers. So that's my second take-home message. And my third take-home message is actually something I spoke about in my second message as well. Remember, everyone's doing a job here. Your receptionist is no less important than you. Your receptionist or the guy or the person who's or the attending who's going ahead and giving the injections in the evening is no less important than you. You've got to stay humble, you've got to stay focused, and you've got to keep learning. Otherwise, it will become impossible to keep changing in this quickly changing environment. So from that perspective, these are important things that I think will keep all of us in the right stead and keep us open to outer interactions and keep learning from other people and move our practices forwards. We train people a lot. Now, that's a very old photograph and a very old pamphlet, but we train people a lot. So training the next generation of people is very important for us. And that's the book that I was telling you about. It's a book which is of and about doctors, written for doctors. And this is an Amazon bestseller. And this book talks about heartfelt stories in the medical environment, sort of like Grey's Anatomy. And so from that perspective, I do request and recommend that all of you read it. That's all from me, Debraj Chom. And I'd love to hear your feedback on some of the things that I've spoken about in this particular talk. I didn't have too much time, but in the short period of time, I hope I've managed to add some value and give you the benefit of my experience. And I hope that you will be in touch. And if I can contribute in any way to your growth, please do consider me in. Thanks so much. And thanks to the AIS and the ACS for having me here today. Thank you very much.